Aortic stenosis is a condition that affects the aortic valve, one of the 4 valves in the heart. It's a serious condition that can have significant implications for heart function and overall health. In this video, we'll explore what aortic stenosis is, how it develops, the symptoms associated with it, and the management options available for those diagnosed with this condition. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. The heart functions as a powerful pump, circulating blood throughout the body to deliver oxygen and nutrients to tissues and organs. It consists of 4 chambers, 2 upper chambers called atria and 2 lower chambers called ventricles. The blood flows through these chambers in a specific sequence, guided by 4 valves that open and close to ensure that blood moves in the correct direction. The aortic valve is one of these crucial valves. It sits between the left ventricle, which is the main pumping chamber of the heart, and the aorta, the largest artery in the body that carries oxygen-rich blood from the heart to the rest of the body. In a healthy heart, the aortic valve opens fully when the left ventricle contracts, allowing blood to flow freely into the aorta. It then closes tightly to prevent blood from flowing backward into the heart. However, in aortic stenosis, the aortic valve becomes narrowed, restricting the blood flow from the left ventricle into the aorta. This narrowing forces the heart to work harder to pump blood through the valve, which over time can lead to a range of symptoms and complications. Aortic stenosis can develop for several reasons. The most common cause is age-related calcification. As we age, calcium deposits can accumulate on the aortic valve, causing it to stiffen and narrow. This process typically occurs slowly over many years and is most common in older adults, usually over the age of 65. Another cause of aortic stenosis is congenital heart defects, where individuals are born with a malformed valve. The most common congenital defect leading to aortic stenosis is a bicuspid aortic valve, where the valve has only 2 cusps or leaflets instead of the usual 3. This abnormality can cause the valve to wear out more quickly and lead to stenosis at a younger age. Less commonly, aortic stenosis can result from rheumatic fever, a complication of untreated strep throat that can cause inflammation and scarring of the heart valves. The symptoms of aortic stenosis often develop gradually and may go unnoticed in the early stages. As the condition progresses and the valve becomes more narrowed, symptoms may become more apparent. One of the most common symptoms is shortness of breath, particularly during physical activity. This occurs because the heart is struggling to pump enough blood through the narrowed valve to meet the body's increased demand for oxygen during exercise. People with aortic stenosis may also experience chest pain or discomfort, known as angina. This pain occurs when the heart muscles do not receive enough oxygen-rich blood due to the increased workload on the heart. The pain is often described as a tightness or pressure or a squeezing sensation in the chest and may radiate to the shoulders, arms, neck, or jaw. Another common symptom of aortic stenosis is fatigue or a feeling of being unusually tired. This can occur because the reduced blood flow from the heart means that the body's tissues and organs are not receiving enough oxygen, leading to feelings of exhaustion even with minimal exertion. Some people with aortic stenosis may also experience dizziness or lightheadedness, particularly when standing up quickly or during physical activity. In severe cases, aortic stenosis can cause fainting or syncope, which is a sudden temporary loss of consciousness due to insufficient blood flow to the brain. As aortic stenosis progresses, it can lead to complications such as heart failure. Heart failure occurs when the heart is no longer able to pump blood effectively, leading to a buildup of fluid in the lungs and other parts of the body. Symptoms of heart failure may include worsening shortness of breath, swelling in the legs and ankles, and difficulty lying flat due to breathlessness. Because of the serious nature of these symptoms and the risk of complications, it is important for individuals with aortic stenosis to receive appropriate medical evaluation and management. The diagnosis of aortic stenosis typically involves a combination of physical examination, imaging tests, and other diagnostic procedures. During a physical exam, your doctor may detect a heart murmur, which is an abnormal sound heard through a stethoscope that can indicate turbulent blood flow across the narrowed valve. If a murmur is detected, or if there is suspicion of aortic stenosis based on symptoms, further testing is usually required and to confirm the diagnosis and assess the severity of the condition. One of the most common imaging tests used to diagnose aortic stenosis is an echocardiogram. This test uses ultrasound to create detailed images of the heart and its valves. An echocardiogram can show the size, shape, and movement of the aortic valve, as well as measure the degree of stenosis and assess the overall function of the heart. Other tests that may be used include an electrocardiogram or ECG, which measures the electrical activity of the heart, and a chest X-ray, which can show the size of the heart and the condition of the lungs. In some cases, a cardiac catheterization may be performed. This invasive procedure involves threading a thin tube or catheter through a blood vessel to the heart to measure pressures within the heart chambers and across the aortic valve. Management of aortic stenosis depends on the severity of the condition and the presence of symptoms. In mild cases where symptoms are absent or minimal, careful monitoring may be all that is needed. This may involve regular follow-up visits with a cardiologist and periodic echocardiograms to track the progression of the disease. During this time, it is important to maintain a healthy lifestyle, including regular exercise, a balanced diet, and avoidance of smoking to support overall cardiovascular health. For individuals with moderate to severe aortic stenosis, especially those who are experiencing symptoms, more active treatment is usually required. The most definitive treatment for aortic stenosis is valve replacement surgery. There are two main types of valve replacement procedures: surgical aortic valve replacement and transcatheter aortic valve replacement, or TAVR. Surgical aortic valve replacement has been the standard of treatment for many years. It involves open heart surgery to remove the narrowed aortic valve and replace it with either a mechanical valve made of durable materials like metal and plastic, or a biological valve made from animal tissue. Mechanical valves are very durable and can last a lifetime, but they require the patient to take anticoagulants such as warfarin or newer drugs such as apixaban for the rest of their life to prevent blood clots. Biological valves, on the other hand, do not require long-term blood thinners, but tend to wear out over time, often needing replacement after 10 to 20 years. Transcatheter aortic valve replacement is a newer, less invasive option that has become increasingly popular, particularly for patients who are considered high risk for traditional open heart surgery. In TAVR, a new valve is inserted via a catheter through a small incision in the groin or chest and guided to the heart, where it is positioned within the existing aortic valve. The new valve then expands, pushing the old narrow valve leaflets aside and taking over their function. TAVR has been shown to be as effective as open heart surgery in many patients, with the added benefit of a shorter recovery time and less physical trauma. In some cases, balloon valvuloplasty may be used as a temporary treatment to relieve symptoms of aortic stenosis. This procedure involves threading a catheter with a small balloon at the tip through a blood vessel to the aortic valve. The balloon is then inflated to stretch the valve open and improve blood flow. However, this procedure does not provide a long-term solution, as the valve tends to narrow again over time. It is often used as a bridge to valve replacement surgery or for patients who are not candidates for surgery. In addition to these procedural treatments, managing aortic stenosis also involves addressing any associated conditions, such as high blood pressure or heart failure. Medications may be prescribed to control blood pressure, manage symptoms of heart failure, and reduce the risk of complications. However, it is important to note that no medications can reverse aortic stenosis or stop its progression. They are used primarily to manage symptoms and improve quality of life. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Be sure to leave a comment below if you have any topics you want covered in future videos. Anyway, lifestyle modifications are also an essential part of managing aortic stenosis. Patients are often advised to engage in regular physical activity, but to avoid excessive exertion that could put additional strain on the heart. A heart-healthy diet that is low in sodium is recommended to support cardiovascular health. Smoking cessation is crucial, as smoking can worsen cardiovascular disease and increase the risk of complications. Regular follow-up with a cardiologist is important for individuals with aortic stenosis, regardless of the severity of their condition. Monitoring the progression of the disease and adjusting the management plan as needed is key to preventing complications and ensuring the best possible outcomes. In cases where valve replacement is necessary, early intervention can prevent the onset of irreversible heart damage and improve long-term survival. So aortic stenosis is a challenging disease, but with the right management and support, you can live an active life and prevent serious complications. Monitoring the disease is important and intervention is needed if progression occurs or if symptoms are impacting your life. Luckily, there are treatments available that are very effective. Thank you for watching. As always, take care of yourself and make the most of your day.